Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, we're doing another Kahoot, but this time we're going to be going over cerebrovascular accident. We're going to be going over the patient with stroke. We're going to be going over drugs, diagnostic tests, nursing interventions, patient teaching, all that good stuff. Before we get started, as always, I'm going to ask you to please support me and support this channel by liking this video. You're going to love it. Go ahead and give it a thumbs up now. Subscribe to my channel if you haven't done so already. And be sure to check out my website, nexusnursinginstitute.com. There you can sign up for a next generation NCLEX review session, both part 1 and part 2. In part 1, I teach you how to think critically. I teach you about prioritization and delegation and different words and phrases and scenarios that NCLEX may present to you and where your brain is expected to go, right? In part 2, we go over actual NCLEX type questions, rationales, and how you should be able to apply those concepts to the type of questions that you get on your exam. Maybe you would like some private one-on-one tutoring. I offer private tutoring sessions. You can sign up for that. Or if you want to pick my brain about something, you need some advice in the nursing arena, you can sign up for that. Or maybe you have to do really well on your next exam. You are about to flunk out of this program and you really have to knock it out of the ballpark. I have audio lessons available. Check my audio lessons and see if I have one that matches the subject matter of your upcoming exam. Thank me later. Almost daily, you can find me covering a variety of nursing topics across my social media platforms, TikTok, Instagram, Facebook, YouTube. My handle is the same everywhere, Nexus Nursing. Now, without any further ado, guys, let's get started. Cerebrovascular accident, aka stroke. First question. All right, which finding would most likely cause you to suspect a stroke in your patient? Would it be sudden severe headache and unilateral weakness, gradual onset of muscle weakness, bilateral weakness in the lower extremities, or a slow progressive memory loss? Which clinical manifestation would cause you to suspect that your patient is experiencing a stroke? If you weren't able to get into the Kahoot, you guys can just put in your answer on the live as well. Very good. Sudden, severe. That word sudden right now, acute, okay? Sudden severe headache, unilateral muscle weakness. What are we suspecting? Most likely a vessel burst. The patient could have been hypertensive, vessel burst, they got a stroke, unilateral weakness. This is a classic sign of stroke. Slurred speech, facial drooping. Make sure you guys know those classic clinical manifestations of a stroke. Now let's look at the wrong answer choices. I'm so happy most of you guys chose the correct answer. Let's look at the wrong options. Gradual onset of muscle weakness. When you see that, what should you be thinking about? Most likely myasthenia gravis. How about bilateral weakness in the lower extremities? When you see that, you should be thinking maybe something like Guillain-Barré syndrome. And last, slow progressive memory loss. With that, you should be suspecting what? Dementia, right? But when it comes to that patient with a sudden severe unilateral weakness, you should be thinking of a stroke. How are you guys doing on the live? Okay. Question number 2. Your patient just had an ischemic stroke. What is the primary cause of this type of stroke? Would it be bleeding into the brain? Would it be obstruction of blood flow to the brain? Would it be aneurysm rupture? Or would it be brain tumor compressing the blood vessel? Very good. Obstruction of blood flow to the brain. So guys, the ischemic stroke, this basically causes death of the tissue from lack of oxygen. Remember, oxygen is carried in hemoglobin. Hemoglobin is carried in the red blood cell. The red blood cell is part of what? Blood. So when blood is obstructed, that blood flow is obstructed, perfusion goes down, that oxygen isn't going to the tissues. Those tissues need oxygen in order to survive. Now, let's look at the wrong answer choices. Bleeding into the brain. That's what? A hemorrhagic stroke, right? Aneurysm rupture. Let me explain to you what an aneurysm is. So an aneurysm is a weakness in a vessel, a blood vessel. right? So the patient can have weakness, but if they have hypertension, something else happens, and that weakness now ruptures, that can cause a what? Hemorrhagic stroke. And then last, brain tumor compressing against blood vessels, that also can cause a stroke. And guys need to remember that brain tumor is taking up, number one, is taking up space in the brain, and two, causing compression. Okay, but the correct answer for this, when we're talking about an ischemic stroke, again, would be obstruction of blood flow. Remember, oxygen is being carried in the blood. So guess what? If that blood's not moving, neither is oxygen, and those tissues are going to start to die when they're not being perfused adequately. Which patient is at highest risk for a stroke? Here are your options. We have a 55-year-old male with controlled hypertension. We have a 70-year-old female with AFib and diabetes. We have a 30-year-old female who smokes occasionally. And then we have a 40-year-old male with a family history of stroke. Who's at the highest risk? Most of you got it right. A 70-year-old female with AFib and diabetes. And I thought I was going to trick more of you guys, but only 6 of you guys went with the patient that smoked, because it's a common, joke in the nursing field. Oh, if it's smoking, that's the answer. It's always smoking. It's not always smoking. Right? Yes, smoking causes so many complications, but it's not always smoking. Let's talk about this. So the first one, you have a 55-year-old male with controlled hypertension. It's older person, that's one risk factor, 55, and they're male. That's 2 risk factors. The hypertension is controlled. Then you have a 70-year-old female with AFib and diabetes, 70, older. AFib, that's definitely a risk factor. Let me tell you something. Whenever you see AFib, you better be thinking of clots. That's your biggest nightmare, right? Well, one of your biggest nightmares, I should say. And of course, diabetes. That's 3 risk factors. Remember, diabetes increases your risk for atherosclerosis. A 30-year-old female that smokes occasionally, smoking. And last, a 40-year-old male with family history, male, family history. So who has the most risk factors here? The older female with AFib and diabetes. I can see the screen. Oh, okay. I'll try to make the screen bigger for you. Oh, this is the best I can do, guys. Is this better? Okay, next question. Which diagnostic test is most important to perform immediately for a patient presenting with stroke symptoms? Would it be an ECG? Would it be an MRI? Would it be a CT scan? Or would it be a lumbar puncture? Again, which diagnostic test is most important to perform immediately for a patient that is presenting with signs and symptoms of a stroke? Would it be ECG? Would it be MRI? Would it be CT scan, or would it be lumbar puncture? Very good. Non-contrast. Very good. Notice it said non-contrast, non-contrast CT scan. We don't know if that patient has a hemorrhagic stroke, right? Non-contrast. We do not use contrast media. Very good. Now, that's the correct answer. Let's talk about the incorrect answer choices. ECG. When would an ECG be preferred? Well, an ECG would be preferred when we suspect, some type of cardiac dysrhythmia, right? So that's going to look at the electrical impulses on the heart, something like AFib, VTAC, SVT, something like that. Now, next, MRI. MRI would be preferred when we'd want to look at like soft tissue disorders of the CNS, or maybe want to look into be able to visualize the joints, right? And then last, lumbar puncture. Lumbar puncture would be done like if we want to analyze the cerebral spinal fluid, maybe the patient has meningitis, and we don't know what's growing in that cerebral spinal fluid. We don't know if it's viral. We don't know if it's bacterial. And if it is bacterial, what type of bacteria. So if we want to analyze that, it would be something like that. or maybe if the patient has increased intracranial pressure and we want to relieve that intracranial pressure, a test like lumbar puncture would be performed. Okay, you're monitoring a patient after thrombolytic therapy. Which finding would be most concerning to you as a nurse? Would it be headache and nausea, blood pressure of 145 over 90, slurred speech and facial drooping, or new onset of confusion and agitation? Again, you're caring for a patient after thrombolytic therapy. Which finding would be most concerning to you? Wow. 20 of you chose slurred speech and facial droop. Okay, let's talk about this, guys. So I told you the subject is stroke, right? And in this question, it tells you that you're caring for a patient with thrombolytic therapy. This patient had a stroke. They had a clot. Thrombolytic therapy. Let's break down that word. Thrombo, clot, lytic, to break down. So they got, excuse me, drug therapy to dissolve that clot that was causing obstruction in that vessel, right? So we had to choose one thing that was most concerning. You're trying to tell me it's the slurred speech and facial droop. Don't you think they have that slurred speech and facial droop from the stroke that they had? Hence why they're getting the thrombolytic therapy in the first place. Make it make sense. Make it make sense. Look at our options. Headache and nausea. Yes, that's concerning. I'm not saying we don't care about it, but most likely that's from that stroke that the patient already has. Blood pressure of 145 over 90. I'm not saying that's not concerning because that blood pressure is high, but again, it's not going to put their life at risk like the correct answer choice, right? And it could be from a remnant from that stroke they just had. Slurred speech and facial drooping. Guess what? I just told you slurred speech and facial drooping. Those are classic symptoms of stroke. Stroke that the patient just had. That is why they're getting thrombolytic therapy. So why would that be most concerning to us when the patient has a new onset of symptoms? Let me tell you something. Anytime a patient has something that's new, anytime a patient has something that's acute that was not there before and it's not good, such as confusion and agitation, that's going to be your priority. Guess what? Confusion, agitation by itself is concerning because whenever patients confused or agitated, most likely what's happening is not enough oxygen to the brain. That is what's causing that change in cognition, and it's new. So we can't even attribute this to the stroke that the patient just had. That's the reason we're giving them the thrombolytic therapy, because this is what? New. Are you guys following me on the live? All right, let's keep going. Your stroke patient has a left-sided hemiparesis. Which intervention should the nurse prioritize? Would it be encouraging the patient to perform active range of motion exercises on the left side? Would it be to place objects within reach on the left side? Would it be to teach a patient about the use of assistive devices to dress independently? Or would it be to position the patient to prevent contractures and promote circulation? What do you think is the correct answer? Very good. We want to prevent contractures and promote circulation. When it comes to stroke, guys, one of the biggest complications we're concerned about is going to be decreased mobility. It's going to be contractures. It's going to be that patient's physiological integrity, right? So that is the correct answer. Now let's look at the wrong answer choices. Encourage the patient to perform active range of motion exercises on the left hand. That is something good. We're going to promote active range of motion exercises as much as they can do. And we're going to do passive range of motion exercises with them. Very good. Why? We want to prevent contractures and increase circulation. Remember, guys, I told you when you have a multiple choice question and you see an umbrella answer, you see one answer that includes another answer, choose that as your answer. This is a perfect example. Next, place objects within reach of the left side of the bed. Why would you do that? You want that patient injured themselves. They are weak on that side. They'll mess around and fall out the bed or hurt themselves or can't even reach it. No. Teaching the patient to use assistive devices to dress independently. Well, that's something great in rehab for that patient to learn. By the way, that's going to be that type of therapy is considered, what's it considered? Give me a sec. I'm going to tell you the name of it. Tertiary. That's a tertiary type of preventative measure. You need to know that. But guess what? That's not your job as an RN. That's going to be whose job? The occupational therapist. That's the occupational therapist. They're the ones who's going to teach the patient how to dress themselves again or comb their hair or brush their teeth, right? You guys follow me on the live? Time ran out. Okay, well, here's the thing on the Kahoots. When it's multiple choice, I always give 30 seconds, but if you like on the next Kahoot, I'll make it 45 just to give you guys more time, okay? I'll do that for the next Kahoot. All right, moving on. Your patient with a CVA has dysphagia. What is your priority action when providing oral care? Is it to encourage the patient to drink fluids before the procedure? Is it to keep the patient in a supine position? Would it be to inspect the oral cavity for food pocketing? Or would it be to use a toothbrush with soft bristles? Your patient has dysphagia. What's going to be your priority nursing action? Very good. You're going to inspect the oral cavity to make sure that patient isn't pocketing or cheeking food. Because what happens when you have a stroke on the left side of the brain, you're going to have right-sided weakness. If you have stroke on the right side of the brain, you're going to have left-sided weakness. And so what happens is that patient's chewing and on the side of their body where they have weakness, they might not even be able to feel that there's food there. So they think they swallowed the whole food, but they didn't. And it's there between their gums and their cheek, and there's a high chance that they can aspirate, right? So we're going to check for that. We're concerned about aspiration and something else. Food that just sits here in your mouth, what do you think happens? What do you think happens when there's food or fluid that just sits? Bacteria starts to grow. And they don't like to stay in one place. They like to move. And before you know it, patient's got an upper respiratory infection just because you did not do a proper assessment on your patient. Okay, now let's look at the wrong answer choices. Encouraging the patient to drink fluids before the procedure. How's that going to help your patient? I just threw that in there. That makes no sense. Next, keeping the patient supine. Do you want them to aspirate? Do that if you want to. You're providing oral care. You want the patient sitting up. You don't have them lie down. You have the patient lie down when you're providing oral care. That is not very nursey. That's very, I want to lose my license. Okay. And last, using a toothbrush with soft bristles, you do that for a patient who, had to be on bleeding precautions. We don't want them to bleed out. That's not this type of patient. A patient with expressive aphasia following a stroke becomes frustrated when trying to speak. What is the best nursing intervention? Would it be to encourage the patient to write down their thoughts? Would it be to speak slowly and clearly to the patient? Would it be to allow the patient plenty of time to communicate? Or would it be provide a detailed instruction to the patient? Again, your patient has expressive aphasia. Which nursing intervention would be most appropriate? Okay, before I get to this, I saw the question on the live. I have plenty of pediatric videos. I have a whole playlist that's dedicated to pediatrics. There's well over 50 videos in that playlist, okay? You'll find plenty of pediatric videos in my pediatrics playlist on YouTube. All right, back to this, guys. Very good. Most of you guys chose the correct answer. Allow the patient plenty of time to communicate. This is a famous test question. It's going to take them time. Go back to the question. They have expressive aphasia. The problem is them being able to express themselves. So you have to be patient. Don't try to finish their sentence for them. Don't cut them off. Don't start guessing. You're just going to make them more frustrated. Be patient. When I say be patient, sit down, eye level with them. Don't stand up, because if you're standing up and they're, sitting down or lying down, it's going to seem like you have somewhere better to be. Don't tap your foot. Don't keep looking at your watch. Don't keep looking at the door or down the hall, right? Because no, non-therapeutic communication, such as body language, says a lot more than words do. Now, let's look at the wrong answer choices. Encouraging the patient to write down their thoughts. No, we want them to use their words. They have expressive aphasia. We want them to get better at communicating their thoughts through verbal language. So false. Next, speak slowly and clearly to the patient. Is there anything in this question that said that patient can't hear? Or that the patient has a cognitive deficit where they can't understand what you're saying? No. And last, provide detailed instructions to the patient. Again, there is no developmental delay. There's no cognitive deficit. What the problem is, they're having trouble expressing themselves, okay? A patient with left side weakness is at risk for falls. Which nursing intervention would be most appropriate? Would it be to allow the patient to ambulate independently with a walker? Would it be to keep the patient in bed and use all 4 side rails? Would it be to assign a sitter to stay with the patient at all times? Or would it be to teach the patient to call for assistance before getting out of bed? Which would be most appropriate for the patient with left-sided weakness that is at risk for falls? Very good. Teach them to call for assistance. Tell them this is a call bell. This is a light. Press it if you want to get up for any reason. That's it. Look at the wrong answer choices. Allow the patient to ambulate independently with the walker. Yeah. Yeah, you definitely want them to fall. Next, keep the patient in bed and use all 4 side rails. You are restraining that patient illegally. Absolutely not. Next, assign a sitter to stay with the patient at all times. Is there anything in this question that said this patient is a self-harm risk, that they want to harm themselves? Absolutely not. Is there anything in this question that said that you've already taught the patient to call for assistance, but they keep getting up because they're confused, or there's some type of cognitive delay where they don't understand, and so they keep getting up, and so that would be a reason why we would have to have a 24-hour sitter, but there's nothing in this question that mentions that, okay? All it says is they have left-sided weakness and they're at risk for falls, okay? So cognitively speaking, we should be able to tell them, hey, press the call button if you need to get up, and that patient will do so, okay? All right, one more question. Which assessment finding in a patient with a stroke should be reported immediately to the healthcare provider? Worsening headache, mild facial droop, slurred speech, or new onset of unequal pupils? Again, which assessment finding in a patient with a stroke should be reported immediately to the healthcare provider? Worsening headache, mild facial droop, slurred speech, new onset of equal pupils. Very good. Very good. Guys, on the live, what is the one word in that answer choice that made you know that's the correct answer? New onset of unequal pupils. What word? New. Very good. Very good. If something is new with your patient and it's not for if something's new but it's good, okay, great. But if something's new and it's bad, that's always going to be your priority. I cannot stress this enough. All right, guys, on the live, I have another question for you. That last option, new onset of equal pupils, if that was not there, this was not an option for you. You had worsening headache, you had mild facial droop, and slurred speech. Between those 3, which would be your priority to report to the healthcare provider? Oh, I'm so proud of you. Yes, worsening headache. Out of worsening headache, which word made you know that would be your priority? Would it be worsening or headache? Yes, worsening. Worsening. That lets you know there's been a change. It's gotten worse. There's been a change and it's not for the good. It's gotten worse. All right, guys, there are so many things that I could teach you about stroke. So if you guys would like to see a part two Kahoot, let me know in the comment section. Maybe you don't want to see in a Kahoot format. Maybe you'd like me to. I think I already have a lecture posted on stroke. I'm almost sure I do. But if I don't, I would be glad to do a lecture on that, or maybe a Q&A. You'd like a Q&A. Go ahead, sound off in the comment section. Let me know what you guys think. Yes, I have many comprehensive Kahoots. If you go to my YouTube channel, I have different playlists. I have a playlist for Kahoot, and you'll see I have many comprehensive ones that cover everything. All right, guys, let's see how you all did on this Kahoot.